I'm Dr. Karl, coming to you from the lands of the Gadigal people of the Eora Nation. I acknowledge Aboriginal and Torres Strait Islander peoples as the first Australians and traditional custodians of the lands where we live, learn and work. G'day, Dr. Karl, Shirtloads of Science, University of Sydney, with Professor David Spiegel from Stanford University to talk about hypnosis. Did I get any of that right, or most of it right, Dr. David?
You got it all right, Dr. Karl.
I've been fascinated by hypnosis for a long time. How did you come into it? Like, on one hand, you have a story about your father using it.
It's kind of a genetic illness in my family. My father was finishing his psychoanalytic training. Both my parents were psychiatrists and psychoanalysts, and they told me I was free to be any kind of psychiatrist I wanted to be, so here I am. He, at the end of a session, his analyst said, Herb, would you like to learn about hypnosis? And my father wondered what he'd said wrong during the session. And it turned out that there was a Viennese refugee named Gustav von Aschaffenburg, who was a forensic psychiatrist in Austria, and he had a big smallpox scar right in the middle of his forehead. And he noticed that when he was interviewing some of these prisoners, they would sort of nod off and go into some altered state. And he got curious about hypnosis. He was using it. And when he escaped to the United States, he wanted to do what he could for the war effort. And he said, I'll teach young army doctors how to use hypnosis. So my father was taught by him. He used hypnosis in combat to help with combat stress reactions and with pain. And when he came back, he continued his analytic training, but continued his interest in hypnosis. And he discovered from calling his patients after he'd finished treating them that often he got as far with hypnosis as he did with psychoanalysis. And so he moved more and more of his practice to that. And the dinner table conversations were pretty interesting. I got to watch him film patients with hysterical seizures that he helped with hypnosis. So I took a course on it when I went to medical school, and I've been doing it ever since. I could see how quickly it could help people with even very serious problems, and I got more and more interested in using it and studying it.
Now, I see from the Stanford University webpage that you are the Wilson Professor and Associate Chair of Psychiatry and Behavioural Science. So you started off doing a Bachelor of Arts and then a medical degree, and then you went into psychiatry. Is that a good summary?
That's correct. That's right. I went to the Massachusetts Mental Health Center and Cambridge Hospital at Harvard, did my psychiatric training there, and then decided to have a go coming out west, and wound up at Stanford and never left.
Hypnosis is one of those sort of fuzzy areas in medicine where people either swear by it or say that it doesn't work, or say that it works but it's a placebo thing. How would you say it's different from a placebo?
None of the above. It's stronger than a placebo. A placebo effect, which is real and very widely general and accounts for a lot of improvement in medical care, is a general expectation that the doctor is going to do something that will make you feel better. Studies have been done comparing low and high hypnotizable people with both placebo and hypnosis, keeping your hand in circulating ice water so you know how long they can tolerate it. And for low hypnotizables, placebo and hypnosis were the same thing. For high hypnotizables, hypnotic analgesia was far stronger than placebo analgesia. So they could keep their hand in the circulating ice water a whole lot longer if they were high. So basically, placebo is kind of a baseline condition, which is important. And it could be a part of hypnotic response, but most of hypnotic response is different. It's controlling your perception of pain, for example. You literally reduce the amount of pain you feel.
You've also written that placebo requires deception to work. But there have been some recent studies where they've been saying, we're going to give you a placebo, and yet some of the people who have been told they're getting a placebo still have the pain-relieving effect. What's going on there?
Yes, well, that can happen because people don't worry about the sort of logic of is a placebo simply a positive expectation? And they figure, well, even if it is a positive expectation, it makes me feel better. That, I suspect, are the more hypnotizable subjects doing this, who say, well, this doctor is setting a condition whereby I can make my pain feel different. I can control my pain or control my anxiety. And so some of it may be tapping into hypnotic abilities. And I would think that's more likely among the patient in the known placebo condition who were also highly hypnotizable.
Now, you've mentioned this concept of people being hypnotizable, and I'm imagining that there'd be some people who'd be very hypnotizable, not at all, and in between. Can you talk about why that happens? Because, as an example, with regard to just plain old boring opiates and the drug called codeine, 90% of
Mhm.
people can turn codeine into morphine internally and get an effect, but 10% cannot, and they get zero pain relief pharmacologically, but nevertheless they do take it, and they do get an effect
That's
from the
right.
pain relief. So can you
The
talk
placebo.
about
Yeah.
why are some people susceptible? Does anybody know, for example?
Yes. Yeah. We know a fair amount about it. We find that when we put people who are high and low in hypnotizability into the functional MRI scanner, the ones who are
Ah,
high have more functional connectivity between the left dorsolateral prefrontal cortex and the dorsal part of the anterior cingulate cortex, which is part of the salience network. And so if you're able to coordinate what you're trying to do, what you're thinking about with the part of your brain that would otherwise distract you and say, wait a minute, there's something more interesting, or there's a noise over there I should explore,
yep.
you're more likely to be highly hypnotizable. We know there are genetic differences between high and low hypnotizables, that there's a gene for dopamine metabolism, catechol-O-methyltransferase, and people who have one of the variants of that gene, the methionine and valine heterozygote, turn out to be more hypnotizable than those who have a homozygote for methionine or valine and who have either very fast or very slow metabolism of dopamine. And we can measure it now. We've developed a test to measure it at the bedside for patients. The other part of it, Dr. Karl, is a life experience. So it
Ah,
turns most children, most 8-year-olds are in trances most of the time. You call your kid in for dinner, he's out playing, he doesn't hear you. Parents who read their kids stories at night, who have what are called imaginative involvements, turn out to retain more of their hypnotizability through adolescence. That's a period where you develop more respect for logic and reasoning and less for just pure experience. Some people lose a lot of their hypnotizability when they get into their 20s. By then, it's as stable a trait as IQ over a 25-year interval. The other thing that tends to help people to retain hypnotizability is not a good thing. It's physical or sexual abuse in
ah,
childhood. And those people use it as a defense. They say, I had a patient who said, I just went to a mountain meadow full of wildflowers when my father did whatever he did to me. And so for them, it's a precious and necessary defensive resource against the experience of trauma. So there's good and bad news about the sources of high hypnotizability in adult life.
I've been reading a little bit about it. Obviously, I don't know as much as you do, and I've come across the concept that there are, with regard to highly susceptible subjects, there are fantasizers and dissociators. Now, is that totally obsolete now? Or have I gone down a blind pathway?
No, there are good people who have explored that option, and I think among the high hypnotizables, there are some, and it may have to do with the history of how they got there. I would imagine, for example, the people who were retain their high hypnotizability because they had imaginative involvements,
Yeah.
they're still fantasizing. They love it. They get absorbed in it. It's like getting so caught up in a good movie you forget you're watching a movie. The dissociators, I suspect, are more likely the people who were traumatized as children and who had to disconnect and just imagine they were somewhere else when it was happening. So it makes
Ah.
sense to me that there are those two types of high hypnotizables.
Now, I've been trying to understand hypnosis for a long time, and I keep
Mm-hmm.
on coming across it's not real and it is real. There's two big dichotomies. But how would you define hypnosis? Like, part of it would be focused attention.
That's correct.
And
Highly
what can you
focused
talk about that?
attention.
Yep.
It's like looking through the telephoto lens of a camera. What you see with great detail, but you're less aware of the periphery. It's like the experience of getting so caught up in a good movie that you forget you're watching a movie. You're not in the audience, you're in the movie. So that intense concentration, the intense focus is one part of hypnosis. The second is
Ah,
dissociation. To do
ah,
that, you have to be able to put outside of conscious awareness things that would be in consciousness. Right now, I can sort of see that you're sitting in a chair.
yep,
And I'm going to place a bet that you were not aware of the sensations in your bottom and your legs touching that chair until I mentioned it. Am I right about that?
correct.
Good. If I were wrong, we could just end the interview now. You would be bored. But so we do it naturally all the time. We're just not aware of it. So you dissociated other sensations in the service of listening. All these interesting things I'm saying. dissociation is a natural component of hypnosis, where in order to focus intently, you put outside of conscious awareness things that would ordinarily be in consciousness. So you put aside sensations in your body that could distract you, but I'm so interesting that you want to pay full attention to that, so you dissociate. Now, the third component is what used to be called suggestibility. It scares people, but it's actually cognitive flexibility. It means and what we see going on in the brain is you suppress activity in the posterior cingulate cortex. That's part of what we call the default mode network. It's the part of your brain that's going when you're thinking about yourself. You're not working on anything in particular. You're wondering what you're like. Did you grow up the way your mother wanted you to? What do people think of you? And you can suspend activity in that area. I call it self-suspension. So you can try out being different and just see what it feels like. And so that's why in the stage shows, the football coach will dance like a ballerina. It scares or amuses people. But it actually is a wonderful basis for psychotherapeutic change. You can see what it would be like if you were a different person, see what it feels like, and maybe start doing it. You can change in that way. This kind of cognitive flexibility, and on formal psychological testing, people who are more highly hypnotizable are able to catch on to new rules. If you have a psychological test where the rules keep changing to get the right answer, people who are more highly hypnotizable catch on to that more quickly. They let go of their old premise about what was going on more easily. So it is a kind of cognitive flexibility that is a real asset in hypnosis.
So you're very firmly on the side that hypnosis is real because you work with it. Where does stage hypnosis fit into this?
It's sort of like comparing modern medications to fish oil salesmen. There are people who really are hypnotized in those shows. But one trick that the stage hypnotists use is they don't just do this with anybody. They don't just take 5 people, because you can't. There, about 20% of the adult population are very hypnotizable. 60% more or less are somewhat hypnotizable, and 20% on the other end just aren't. And you don't want them up on the stage when you're lying them between 2 chairs and sitting on them. So what they'll do is either try out things in the audience and see how many people, their heads fall over, their hands are floating up in the air, or they bring them up and try some hypnotic experiences and excuse some of them to go sit down and get other people up. So at the middle to the end of the show, what they've got is 5 or 6 very hypnotizable people. And that's when they're doing their hypnosis stuff.
What you're saying is that they will do a bit of a pre-check and maybe try something with the whole audience and then select people.
Yes.
But it is a genuine thing that suddenly a football coach is dancing like a ballerina.
Yeah.
Do they have a memory of what they're doing at the time or afterwards?
Some do, some don't. Some are puzzled by it and they wonder what's happening. Others are quite aware of it, but they figured, well, I just thought I'd go along with them and do it anyway. But they do unusual things. They can lie down between 2 chairs and have somebody put weight on them and seem to do okay. It is a genuine experience, and some people do remember it, some don't.
How long have you been using hypnosis as a modality of care in your work as a psychiatrist?
Just about half a century.
So you've seen things come and go and different theories come?
I have indeed. I've used it with about 7,000 people in my career.
7,000. How big a change was it to be able to scan the brain while people are under hypnosis? Firstly, I'm guessing with something as primitive as an EEG and then moving up to the fMRI. Can you talk about that for a bit?
You're exactly right. Initially, I was interested in the pain control issue with hypnosis. It's one of the most spectacular things. People can literally reduce or eliminate pain. The strain in pain lies mainly in the brain.
That's a good one. I like that. That's beauty. Yeah.
If you don't mind, for My Fair Lady, I transformed it a bit.
Love it.
So the thing is, pain perception is a combination of sensory input through the lateral spinal thalamic tract up into the thalamus, the periaqueductal gray, and to the somatosensory cortex. But the whole pain experience is not simply the kind of input you're getting from the body. If you break your ankle or something bad happens in your body, you're having a heart attack, you will get pain signals coming up into the brain. But how you interpret them, how the brain interprets them, will determine a good bit about how much pain you feel. There are football players who break their ankle during the game and don't really notice it until the coach says, your ankle's swollen. What happened? And there are stories of slender women who child gets caught under the car and lift up the car to pull the kid out and don't notice that they've cracked 3 ribs, when they did it. So in extreme circumstances, but this can happen all the time. And in fact, what we did was we took a group of Stanford students, gave them electric shocks to their wrist, measured the somatosensory evoked response. So it's an EEG tied to the administration of the shocks. And in one condition, we just did it normally, and we got the usual waveforms, the P100, tenth of a second, 200, and 300, 3/10 of a second. And then we hypnotized them and said, your hand is in circulating ice water, cool, tingling, and numb. Filter the hurt out of the pain in hypnosis. The P100 disappeared. So within a tenth of a second, the same brain with the same shocks is just filtering out that initial signal. And the P300, which is usually bigger with response or task relevance, was half as big. So we could show that in hypnosis, you can literally change the way the pain feels, change its intensity. And there have been fMRI studies now done by Pierre Rainville at the University of Montreal. And he can show that if you do the same kind of thing, give shocks and tell them the pain's there, but it won't bother you, which is what people say when they're on opioids, you turn down activity in that anterior cingulate cortex I mentioned, the salience network. If you tell them you're filtering the hurt out of the pain, it's there, but it won't bother you. You can feel it, but it's not so bad. You change activity in the somatosensory cortex. So just changing the words you use in hypnosis to describe the analgesia changes the way the brain provides you with analgesia. So the meaning of pain, is it a threat to your life? Is it sudden? Are you afraid it'll never go away? Will tend to intensify pain. Whereas soothing in one way or another, not worrying about it, or literally filtering out the sensation can give you a much reduced pain experience as well using a different part of the brain. So the brain is a context generator. The context in which you experience pain will be related to how much pain you have, and hypnosis can manipulate that.
Now, this initial study you're talking about with the students, firstly, I'm guessing that it was only with the EEG, the electrodes on the head, because you're
That's
talking
correct.
about but secondly, had you specifically filtered the students to try and find the ones who are more susceptible, or did you do it
Yes, we first measured their hypnotizability, and for this experiment, we just took the high hypnotizables.
Maybe part of the belief that hypnosis is a quackery is due to the fact that it doesn't work on everybody, but then codeine only works on 90% of the population.
Well, I got to tell you, Dr. Karl, I am so frustrated with the prejudice against hypnosis, which, by the way, is the oldest Western conception of a psychotherapy. It's the first time a talking interaction was thought to have therapeutic value. And people either say that it's useless or dangerous or both. I want you to compare the fact that last year, 88,000 Americans died of opioid overdoses in the United States. And nobody has yet been killed by hypnosis. It works. It reduces pain. Women give birth, have childbirth, hypnobirthing it's called, with no chemical anesthesia and do just fine. My wife did with our 2 children. You can't say it's not effective. It is. And you can't say it's dangerous because it isn't.
I do like the fact that goes way back to Paracelsus 5 centuries ago, saying that all drugs are poisons. What matters is the dose. And the side effects from hypnosis do seem to be very low. Now, as you did your research over your long career, you moved from the EEGs to the MRIs and the fMRIs. Right. I'll just explain this for the audience who are not familiar with it. The trouble with using a CAT scan on the brain is you've got the bone in the way, which drops your resolution and your sharpness and all sorts of stuff. But the MRI doesn't see the bone. And then did you use the variant of MRI called fMRI to see? Yes. Can you explain that for the audience?
It's functional MRI. What it measures is the bold signal, blood oxygen level dependent signal. And so what it allows you to do is to see where the most current activity is happening in the brain. So the regions where the brain is very active will look different. They'll look whiter than the regions where not much is going on. Now, obviously, the brain's always working throughout, but you can see the relative difference in activity and in the oxygenation of blood, because it's deoxygenated when it's being metabolized and used. And so you can see that difference with beautiful anatomy. The great thing about MRI, as you mentioned, is that not only can you see function, but you can see anatomy explicitly. And that's different from EEG, where you get a collection of electrical activity throughout regions of the scalp, but you can't see the brain anatomy really at all. You can just see the activity through the electrical waves. fMRI is a very powerful technique for determining what's happening. And we've seen, for example, that when you put highly hypnotizable people in the scanner and hypnotize them, they have more functional connectivity between the dorsolateral prefrontal cortex, the executive control region, and the insula, which is, it's Latin for island. It's a little island of tissue in the middle of the prefrontal cortex that is a mind-body conduit. So it's when the brain can control what's happening in the body. We did an experiment once where first thing in the morning, we took a bunch of highly hypnotizable people, told them not to eat breakfast, had them eat an imaginary meal for an hour, and we measured their gastric acid secretion, and it was up 89%.
What?
Just from telling them that they were eating. And one woman, after half an hour, she said, "Let's stop, I'm full," just eating imaginary food.
Wow.
So their bodies were reacting through that connection to the insula, where you can control how the body acts. And the brain, this 3-pound organ on our shoulders is connected to every part of the body. It receives input from every part of the body that we call interoception. It is a powerful tool for controlling what happens in the body. We also found that there was decreased activity in the dorsal part of the anterior cingulate cortex. It's like this C on its ends in the middle of your brain. And the front part is the part of the salience network. If you hear a loud noise, that's your salience network firing off and said, you better see what that is. And it's the source of distraction. In hypnosis, you turn down activity there, and that allows you to concentrate more intently.
I found a list of things that modern hypnotherapy has been used for, with apparently varying degrees of success. And in alphabetical order, they run from addictions, age regression hypnotherapy or hypnoanalysis.
Yes.
Does it work then cognitive behavioral hypnotherapy, Ericksonian hypnotherapy, fears and phobia, habit control, pain management, psychotherapy, relaxation, soothing anxious surgical patients? That's me, I've got terrible pain tolerance. Sports performance, weight loss. Can you give us sort of like a bit of a thumbnail sketch of how effective it is in different fields?
Well, it is. It's very helpful for pain control. It is very helpful for anxiety and phobias. I have people who were afraid to get on an airplane, and I get emails from Europe that they made it and they're fine. One way it works is dealing with stress and anxiety from the body up, rather than saying, don't worry about this, which is a good way to get somebody even more worried. You say, let's start out controlling your body's reaction to the stressor. So imagine you're floating in a bath, a lake, a hot tub, or just floating in space. And you break up that feedback cycle, because when you start to worry about something, what do? You tense up your body, you sweat, your muscles tighten, your heart rate goes up, your breathing gets more shallow. And then you notice that and you say, oh my God, this must be really bad. And you feel worse, and then your body reacts to that. So instead, we use hypnosis to get control of the body's reaction. Whatever the stressor is, you can do something about your body's reaction to the stressor. And then you can picture, for example, your boss yelling at you on one side of the screen, and a good way to respond to him on the other side of the screen. So you have a way of solving the problem once you've tamed your physiological hyperarousal to it. And that's very good for dealing with phobias and fears and anxiety and a lot of other human problems. And hypnosis can really help with that. I
guess that, in fact, then you'd probably agree that the whole satanic brainwashing by playing records backwards, which is so popular in the 80s and 90s, you would have been working when that sort of thing came in. That was kind of silly, wasn't it?
Yes, it was. But we've had a lot sillier things being circulated around in large numbers these days on the internet and social media. So people are forever vulnerable to swallowing whole things that just aren't true.
True. So what would you give as a take-home message then for the audience about hypnotism and hypnosis?
Try it. You'll like it. It's
And
it can really help you change the way your body feels, help you sleep, help you control pain, help you focus more intently on what you're doing, help you quit smoking. It's a very valuable tool, and everybody can at least try it. And the vast majority of people have enough hypnotic ability to take advantage of it. So it's inexpensive, it's effective, right away. And the worst thing that happens is it doesn't work. Big deal.
and there are no side effects. So what were the
And there
numbers
are no
again?
side effects.
20% highly
20% really highly hypnotizable, 60% somewhere in the middle. They have it, they reflect on it, they have it, they reflect on it. And there's 20% who just aren't hypnotizable, and that's okay. They can still benefit from the approach we take with hypnosis, which is focus on what you're for, not what you're against.
So
People
what you're for.
focus on what you're for, not what you're against.
That's nice. Yeah.
Never say to people, don't think about purple elephants. What are you going to do? So instead, we get 1 out of 4 people to stop smoking. And we don't tell them cigarettes are bad or they taste bad or they smell bad. We say, for my body, smoking is a poison. I need my body to live. I owe my body respect and protection. Think of your body as if it were your baby. Would you ever put tar and nicotine-laden hot gas in your baby's lungs? Hell no. Well, your body is as dependent on you are as your baby was. So treat it the same way. Treat it with respect. And a lot of people can affiliate with that. You can feel good from the very beginning.
How can people follow you in your fine work, or if they want to become all the way up to being a patient or a student, doing a PhD with you, what would be the best way to contact you?
We have a website, stresshealthcenter.stanford.edu. So you could go to that www to our website. It's the Center on Stress and Health at Stanford, and we have information about our research there.
That'll then lead you into all things hypnosis related to you and your fine work.
Thank you. Yes, I hope so. Think of it as a hypnotic suggestion.
Look, thank you very much, Professor Dr. David Spiegel, for bringing me up to speed on hypnosis and filling in all the gaps that I wanted to have filled in.
Thank you. It was my pleasure. Thanks for looking into it and having me on, Dr. Karl.
Shirtloads of Science is washed, spun and aired by the University of Sydney.